Hey, welcome to a brand new episode of Show Podcast. I am your host, Calvin. I hope everyone is doing okay and doing safe out there. Yeah, y'all. At the time of this recording, it is now spring-ish, I guess. I don't know. But right now, people are kind of going out and being more relaxed. And at this time, we are now finally kind of being relaxed when it comes to the COVID-19 pandemic. If you follow this podcast, you know that we have an ongoing series called the COVID Impact, how COVID has impacted not just us here in America, but globally, from mental health to weight gain to just being normal. And we want to continue this podcast series as we're going kind of out the door of our season. And we cannot do this without one of our favorite guests on the podcast. She's just now coming back to America finally. Dr. Yvette McQueen, thank you so much for coming back on the show today.
Thank you. I'm so happy to be here.
Yes, ma'am. And you've been a very great part of this series about the COVID impact and telling us all about the vaccine and just what to do, what not to do. And so, and we're going to talk more about what's going on now as it pertains to the COVID-19 pandemic. But for those who don't know you, kind of just tell us about who you are and things like that.
So, yes, my name is Yvette McQueen, MD, and I'm an emergency physician and travel doctor. So, a global physician on a mission to educate about health, travel wellness, and disease prevention. So, I keep travelers healthy and safe while they're traveling, particularly internationally, through my books, my tips. I have a concierge practice where you can dial me up and say, "Hey, doc, what should I do?" So that's why I'm here.
Yeah, and you have been traveling. That's why I said we haven't spoken to you in a while because you have been traveling. And I'm a little jealous of Dr. McQueen because we love to go travel abroad on this podcast and talk to different people, different cultures, and we are all about embracing cultures. But we have Africans on this episode all the time. But I am so jealous because Dr. McQueen has just spent somewhere I really want to go. So can you tell people where you just came back from?
So 5 days ago, I came back from Ghana. So actually, it's been on my bucket list, and I've been putting it off, and so I can finally do it now with traveling. But I went to Ghana and spent 8 days, and I really felt like I was going home. I felt so welcomed, and I was in a country with people that look like me.
And like I said, I'm over here jealous because I'm over here creeping on her page. I'm like, oh my goodness, like this can't be real. This got to be Photoshop because it was just so beautiful, doc. Like it really was.
It's so beautiful and lush, and like I said, the people are so warm. But the one thing that did surprise me, I did not realize their food was so spicy.
Oh, really?
It's great. It's good. I loved it. I got a new little palate and taste buds, but it's a little spicy.
So what's some of the things that you did over there in Ghana? Like, what would you do?
So we was in Accra, make sure I say that right. And we just toured the city, we toured the markets. And actually I was with a company where she grew up in United States, but she moved there 2 years ago. She is but she's native Ghanaian. So she moved there 2 years ago and started a company for Americans, basically. And so she took us to some of the unusual places where tourists usually don't go, and into some of the neighborhoods. We went, I had a naming ceremony, so I have a new name and I have a tribe. We took a boat ride on the Volta River. We did the kente cloth um, place where they make the kente cloth, and also cocoa farm, and shea butter. Oh my God, my skin feels so wonderful.
Did you see her make it? Did you get to see her make the cocoa butter?
Yes, I did. I did. Yeah. Yeah.
So what's your new name, by the way? You got to share it with us.
So they give you your name for the day. Hold on. Oh, I should have brought real quick. Let me
Huh?
show you. I'll show you. Hold on. they give you the name for the day that you're born on. So I was born on a Wednesday. So they actually gave me a certificate. So for my new name.
Oh,
So
wow.
it was Akuya, which is for Wednesday, and then Xanator, which means the doctors have in.
Oh, wow.
I know.
Well, look at you. That
Yeah.
is so cool. Like, I like to all my African listeners right now, like, I'm coming there. I promise y'all. I am coming there. I am going to visit. I don't know when, but I'm coming to visit it because, like, I want a Patente Claw too. I want one really bad. I wanted to see how it's made. I wanted to see everything you see on these kind of like beauty supply stores and stuff like that in Africa. I want to see it
Yes.
made like in the homeland and stuff like that. So, and like big props to you. I'm so happy for you that you got a chance to experience that and get a name.
Thank you.
I want to get a name. I want to feel validated and get a name too. Like I want my African name now. I'm just
I know, because you realize you know the history on this side of the pond, but they have a totally different history of what happened with
Mhm.
us, and that's what I needed to know.
Mhm, and that's what I really love. That's why I have Africans on our show because because of culture and what we don't know, and there's a very big misconception about what we think compared to what they think, and like that has been a joy to learn. So I am so happy to hear that you got a chance to experience that
Yeah.
and do all that. But I have to know this because I know that you're a workaholic like I am. While you were over there, did you do any kind of work or research while you were there, or no, or ask questions medically?
Oh, yeah, I always ask question medically.
Okay.
So actually, what was so cool in the cocoa farm, he told us how from the shell to the nut, actually from making the chocolate to cocoa butter, there's a powder they make, and he was like, "Oh, this is great for diabetes." I was like, "Oh, I need to know that." And he was telling us how the butter is great for eczema. And I was like, "Oh, I need to know that." And did you know their shell is what makes up the black soap
No, I
that
did not
people
know that.
use? Yes. Yeah, so
Wow.
yeah, but I didn't actually work, so no, I wasn't touching patients while I was there, but I still got involved.
Still got intrigued to learn, especially when it's going abroad and stuff like that. Because you're a travel doctor right now, and you've been the COVID-19 pandemic has probably been like one of your biggest things that you've probably been through in your career right now. Going to Ghana, what's the difference that you noticed from traveling to Ghana, just the experience and like then going anywhere else that you've been in so far?
So I've noticed that other countries probably take it more seriously, or even though we're on the tail end. So going back to the pandemic, technically they haven't called off the pandemic. People don't know that, even though they feel like, oh, we're back to normal. They have not technically called off the pandemic, and it's been 3 years. So this is probably the longest pandemic there ever was. But other countries, like in December, I went to Egypt, and you have to show your COVID vaccination card, or you have to, and with going to Ghana, prior to getting there, you have to upload a health declaration form, or the airlines won't even check you in. So those are things that are a little bit different. And people don't shun other people if they decide to wear a mask. People, if they feel comfortable talking to you, that's fine. If they wanted to wear a mask, that was fine too. It was a personal preference, and people just kind of said, "Oh, that's what it is."
Mm. And one thing you kind of alluded to already, and you said, which is kind of like the basis of this episode, being on the tail end of it. And just I'm gonna just go ahead and flat out ask you, where are we globally at with the pandemic? Are we over it? Can we just go back to normal, or should it still be an
Mhm.
area of concern or worry with us?
So once again, the normal you knew in 2019 will never ever be normal again. So I love if we say, "Oh, we can go back to normal." No, COVID is here to stay, but it's gonna be end up being like a seasonal or yearly virus that's there because people are still getting it, whether you have your vaccine or not, and people, unfortunately, people are still dying from it because of their immune systems and different things like that. The WHO, the World Health Organization, has not called off the pandemic. But everyone feels like it is the tail end because a lot of people do feel more comfortable being open without masks. Now, myself, if there's air blowing around and I'm in a big situation where I feel the ventilation is good, I'm okay without it. In some hospitals, we are still wearing it when we have patient to patient contact. And I still wear it on a plane. But I'm gonna tell you, I've been wearing mine because of influenza. Because people, it's not just COVID. People are nasty. I mean, influenza between January and April is influenza. So people's been walking around sneezing, coughing, and influenza will take you down too.
Now, like I'm a medical dummy, and like I said, I just don't know a lot about medical and stuff like that and health as itself. Uh, what exactly? Because I had a friend and her kid had influenza. What exactly is influenza for the people that don't know, especially me?
It's the flu. The influenza is a flu, it's a virus. It's just and they have different strains of it, but it's just a virus and it's the flu and you get a fever, achy muscles. Sometimes people have nausea, vomiting with it. It's a little bit different than COVID because COVID was more respiratory and it hit people's lungs really bad. And that's why it was more severe as far as basically when it came to mortality and death. But it's just another virus out there.
Wow. Y'all, we have Dr. Yvette McQueen, a travel doctor. Man, she is on a mission right now to give us so much medical expertise. I always forget your slogan, so I'm sorry. You're on a
That's
mission.
okay.
What is it? You're on a mission.
I'm a global physician on a mission to educate about health, travel, wellness, and disease prevention.
I'm gonna memorize it, I promise you. But we have more with Dr. Yvette McQueen on the other side of the break. Make sure you stay tuned to the Straight Up Show podcast. Years ago, my family had us scared when we thought my mom had breast cancer. It was painful to see her go through all the testing and witnessing her be just as scared. Fortunately, she did not have breast cancer, but millions of women and men aren't as lucky. So we here at Straight Up are supporting and standing with those who are battling and have survived breast cancer with our official breast cancer awareness merchandise. Just visit our website, straightupshowpodcast.com, and get yours today. All proceeds will be donated to local breast cancer foundations. So we encourage you not only to get educated, but join us as we stand straight up to breast cancer.
Voting. It's a right, a privilege, and a responsibility. Many have made the ultimate sacrifice just so we could have the ability to vote on what we believe is best for us and our community. So, we here at Straight Up ask you to do your research, let your voice be heard, and be proud to say, I straight up voted.
All right, welcome back to the Straight Up Show podcast. I'm your host, Calvin. I am joined today by my special guest, traveling physician, Dr. Yvette McQueen. Thank you so much for coming back on the Straight Up Show podcast.
Of course.
Yes, ma'am. And so she's been telling us, y'all, that we are on the tail end of the COVID pandemic. The World Health Organization has not called off the pandemic, but we are seeing some cases drop down. It's not as much going on, right? Um, Now, because the pandemic was like something that we've never seen, like you said, that 2019 going into 2020, life will never be the same as it is. That sparked so much worry with the pandemic and kind of put myself included, admittedly, in a worry to actually leave and be around people and stuff like that. COVID has really made a big impact on a lot of people. Like you said, like people are nasty, and you really didn't know how nasty people were until the pandemic and stuff like that. Especially people that were anti-maskers and stuff like that. Um, but for people like myself and other people that were worried a lot about just catching it, um, now that we're on a tail end of it, should we still be worried as much?
I would say it depends. You got to look at it individually. So you know what your health status is. You know what your immune status is. I would say if it's a normal, healthy individual that don't have any medical problems, and you've gotten your vaccination, um, you're just gonna treat it like every day. Of course, you don't put your. I don't put myself in situations like if I'm on like the bus from the parking lot to the airport and it's packed, I'll put my mask on. Or when my mom goes out in public because she is, she's 80 and immunocompromised, she'll put it on a mask. But when she's sitting around the house or, one or two people come in the house, she doesn't like run and put her mask on because she's comfortable with that. So should you be worried? I just say just be very cautious considering your individual status because it's close contacts as far as crowded places that basically, and it's like I said, it's not just COVID, it's other viruses out there. I mean, I had some friends that got sick on a cruise and it wasn't COVID and it wasn't influenza, it was another virus because other viruses are out there.
Do you think that because we were telling the COVID and stuff like that, there and correct me if I'm wrong because I'm not really one of those people that's conspiracy theorists stuff like that. But like, do you think that this virus, since we can't really, or have we, since I'm talking to you and you travel a lot, has there been a direct source of where this pandemic has started
Well, we know where it started.
or how it started? I guess yes, ma'am.
We don't know how it started. There's the thing it jumped from animals or was it lab made? Like you said, conspiracy theories. But it's just like any, I mean, people don't know how Zika virus started. Back when was that a few years ago, Zika virus, it started somewhere in the Southeast Asia, moved to South America. They was worried about the Olympics. Babies was born with small heads, and then it started to travel across the world. Unfortunately, fortunately, it wasn't considered a pandemic, but we don't know how Zika virus started either.
Wow. Since you've been doing medicine for how long? No,
Woo!
no, I'm
22
sorry.
years. 22 years.
So you've been doing medicine for 22 years, and um, in your 22 years, you said you've never seen anything like this before, right?
No, because we haven't had a pandemic. I mean, there was the scare with the Ebola, but they contained it. It was right there in it started in Liberia and it hit a few other countries. But the pandemic mean it hit the whole world. But it didn't hit the whole world at the same time. And that's why I think it's lingered for so long because if it had hit the whole world within just the 6 months and then it tapered down, but it hit China first and then it hit us. It hit Europe and then it hit us. And then it went back to China. And now it's in India. It's just it did not hit everything at the same time. So I would say the close to it would be 1920 when influenza came about and they had the influenza pandemic, but none of us was around then, or I wasn't.
I do have like one, I guess, conspiratorial, I guess, question. I guess, do you think that in all your years of medical expertise, that this or anything else can be caused because of biological, not biological, what's the word? I'm tripping. Yeah, biological warfare. Do you think that maybe that's like that can be a thing is when it comes to like different viruses and stuff at all, or no? Okay.
So I don't know if you know, the CDC has vault, a vault of viruses, whether they're natural or man-made, actually out there. So they try to make antidotes. Some of them make antidotes to, like Ebola. We don't have an antidote to it, and there's a couple other that probably is man-made that we don't have antidotes to. But yeah, the only place smallpox is right now is in the CDC vault.
Yeah. Wow. So because it kind of we're on the tail end of it, and I think that more people that really took this serious, this pandemic serious, because there are a lot of people, and just kind of this is like a question that bothers me a lot for the people that were one very anti-vaxxers and anti COVID-19 and getting the pandemic or it's fake and stuff like that, and they've made it throughout this whole thing without even getting the virus or getting vaccinated. Um, How do you address them, especially now that they looked at this as like a victory to themselves?
Well, all of them didn't make it. Trust me on that one. Uh, and you know what? It's not a victory because you know what? We all are born to die. So at some point they're gonna get sick, and a lot of those people have never been on that side of sickness. So that's why they don't believe in it. But this pandemic, you mentioned it before. This pandemic has changed the world. It really did. It changed how people think. Like you said, I'm knowing some people that's just starting to come out their house. Some people still won't go back to their jobs, or they have started their own jobs so they can stay in the house. They limit themselves around people. It's had a big mental shift on people on how they think about themselves and others. So this pandemic did change the world.
Do you think, because the way it impacted the whole world, do you think that one, could this happen again? And two, what are some things that you and your colleagues are maybe trying to do to prevent this from ever happening or be more prepared? Because you all were busy. I've seen the stresses that you, especially you, and that y'all went through during this pandemic. Like, so basically, do you think this could happen again? What are some things that you all are trying to do behind the scenes that we don't know about?
It will happen again. Maybe not in my lifetime, but it will happen again. What are some of the things we do? Well, it was how it was handled, where I would say those that powers that be, and we're not just talking about government. I'm talking about some of the hospital administrators and things like that. They were more about bottom line and fun than they were about people. And that's the honest truth. So and it's if it should happen soon, the medical system cannot handle it. I know several doctors. I know probably 20% of the physician population have left medicine or quitting within the next year because of the last 3 years.
Wow. And you actually know the person that made the Moderna vaccine, right? Or was it Moderna?
Uh, no.
Was it Moderna or was it?
You mean, but the black female that's a
Yes. Yeah.
PhD? Yeah, yeah, yeah.
Okay.
I don't know her personally, but I'm proud of her.
Yeah.
Closest to
But you know of the person that did it. So
Yes.
that's great. So right now as it stands, because we're on the tail end of it, not the cases are going down. Do you think that the people that should we still be getting vaccinated if we have not caught up with our vaccines or what?
I think it's going to become a vaccine like the influenza, like once a year. Once a year they say, okay, flu season start. Make sure you get your flu vaccine and it does not mean you won't get it. It just means you won't get it as severe. So that's what a lot of people are like. I had my 2 vaccines and I still got it. But yes, did you die? That's my point. So if they get their vaccination, they may not have it severe. So the more it's around and the more it's changed, just get the more up to date one. That's why I say get the most up to date one, and you're protected.
I I just love that answer because it was just so straight up, just like, like, did you die? You didn't die. So sorry. That just sorry, the way you responded was it was blunt. It was honest. So yeah, and I'm one of those people that kind of just, I'm still trying to, I don't like to be around people no more because like I used to be so outgoing and stuff, but now it's just like, man, y'all are just careless and just don't even care about, personal hygiene and stuff like that. And, just it definitely has changed the world. We're gonna have a little bit more with Dr. McQueen on the other side of the break. Make sure you stay tuned to the Straight Up Show podcast.
I think straight up means to be able to speak in a way that is straight up, to be honest, and to speak your truth.
Raw, uncut, you know what I mean? It's blunt, straight to the point. This is what it is.
It's just a place to be open and honest, and that's what I appreciate most about it. And it provides a place for community members to come together and just be straight up with each other about things that are going on in the world because it affects all of us.
Unfiltered, raw, with all the cursing that Calvin does.
Straight up is just being real, telling it
telling like it is, being you.
Being solid, being who you are, no matter what it is, no matter what situation you're faced with. All right, this is who you are. It really speaks to me, saying it is what it is and it ain't what it ain't. Straight up.
Summer is approaching. That season where most friends and family travel, have family reunions, and enjoy that family vacation you've had over a year to plan. If you haven't had your vaccinations yet, there's still time. You might think you're fine now, but the reality is you're not. There's still contagious variants out there, and some states and cities are still behind on getting vaccinated. Don't ruin your family vacation by worrying about traveling in a hotspot. And don't be the one to cause a loved one at your family reunion to get sick. If you're still deciding on whether or not to take the vaccine, do some real research. And most of all, do what's best for you and your family. Take the politics out of it. And like everything on our show, think about it with an open mind.
Hey everybody out there, I'm Sultan Salahuddin from Southside. Season 3 is out right now on HBO Max. Make sure you tune in, and make sure you tune in to the Straight Up Podcast Show whenever you are online. Peace.
All right, welcome back to the Straight Up Show podcast. I am your host, Calvin. Today we're joined by Dr. Yvette McQueen. She is a traveling emergency physician on a mission to give people their advice. And I've already messed up the slogan already.
It's all right. They get the gist.
They get the gist. Hey, I'm gonna get it, I promise. But you have definitely been making your impact about this whole pandemic, and you've been a great help to our podcast and kind of raising awareness of this pandemic. And I feel like that, honestly, truthfully, within this podcast, we have grown in to see your messages. So it's really helped listeners. And I know that people that commented on our Facebook and our social media saying that, your tips really helped them out. And so I just want to say to you and all those medical professionals out there, thank you for your help and throughout this whole thing, because you all have definitely put your lives on the line, and you are the unsung heroes throughout the world.
Thank you. We appreciate that acknowledgement.
Yes, ma'am. And like you said, there were some people who are quitting the medical field. I know a bunch of them that are quitting right now, and I hate that because I don't know. Like, I mean, when it comes to that, what is something that maybe medical employers can do better to, I guess, make it easier for y'all?
Well, just listen. So a lot of people that's in health policy and in administration are not medical people. So that was one of the things transition over the last maybe 10 or 15 years. The people in the offices have never actually touched a patient. They're the business people. They're looking at the bottom line. So one thing is basically take our opinion when we say that's not the right way we should treat patients, or no, I'm not kicking this patient out in 2 days when I know they need 4. So just start listening to the clinical people, because we're the ones actually on the bottom line taking care of the patients.
As you wind down with this pandemic and all the stuff like that, now that you've been traveling a lot, since you're more out than most doctors, but what have you been noticing? Any new trends at all since you've been traveling and doing medicine at all, or no?
Just people are more, I think they're a little better as far as their cleanliness, or more people just used to cough and just cough. Now people are more coughing their arm, or they tell their kids that, or they're more cognizant of basically what's going on around them.
And wow. It has definitely been a journey with all of this. And now that, we're on the backside of this pandemic and people are traveling more, you yourself have written a book. And your book is called Travel 911, A Health Guide for Adventures. And with everything going on right now, and it's about to open back up and people are traveling more and going on cruises, what are some of your biggest takeaways, medical expertise that you can give us about traveling this spring and this summer and also this fall?
Okay. So yeah, Travel 911. and I'm just going to plug in there. You can get it at travel911book.com or any Amazon, Barnes and Noble. You can get the ebook. So my biggest thing is staying healthy and safe, that your immune system has to be basically reduce your risk. It has to be up. So a lot of people, my 3 tips, I'm going to tell you real quick. 1, hydrate. So when you're traveling, hydration is really important pre, during, and after the travel, particularly on the plane. That dries you out a lot. People, they do their other different beverages. I won't say what they are, but that also would dehydrate you. So stay hydrated because that'll help to keep your skin moist, your joints loose for if you go on hiking. And in case you get some bad food and have traveler's diarrhea, hydration will keep you up. Even if you need to use supplements, they have the different powders and supplements you can add to water that will give you electrolytes. 2, make sure you're getting your sleep. So sleep is very important because sleep will boost your immune system. So people feel like, oh, I'm packing, I only get 2 hours of sleep, or they're going from tour to tour. It's okay to take naps. I tell people, don't try to pack your full day when you're somewhere. Do something in the morning. That whole afternoon siesta thing is real. Take a nap, even if you're just lounging, and then do something in the afternoon, because the sleep will actually help to reduce your cortisol level, which reduces your stress, blood pressure, and keep your immune system up. And 3, make sure you research and plan wherever you're going. If you're going somewhere, particularly if you've never been there, research that destination, like the weather, so you know what to pack. Research their food source, water source. Research if you have medical conditions. Research what their medical system is like in case you get sick there. And just sometimes the customs that will make your traveling a little bit better. And always get your travel insurance.
Travel insurance.
Travel insurance. So a lot of people say travel insurance, and it's really more like an extra. Sometimes it's extra $60, sometimes it's extra $100. It doesn't depend on your age or medical condition. It depends on the price of the trip. So people, of course, get it for cancellation, delay of bags, loss of bags. But travel also will include medical insurance, because if you're traveling internationally outside the United States, a lot of places will not take your medical insurance card. They don't take Aetna, Blue Cross, blah blah blah. No, they're gonna want a credit card, cash up. You get sick and you need to go to a hospital, they're gonna say, "Where's your credit card? Pay in advance," and they don't have to treat you. So you're no longer in America. You don't get free treatment. So that's one thing about travel insurance, that it will cover you if you get sick, need medical attention, or need to be evacuated back to the United States.
Oh, you you just changed the game, because I did not know any of that at all. Wow, wow. And this is all in the book, right? This is all in the
This
book.
is all in the book.
Y'all have to go get this book, because I didn't know anything about travel insurance and how, wow. Because if you go out there, you just in trouble. Let me ask you a question. So, like, if I was to travel abroad, right, and I'm okay with, like, as it stands right now, if I'm okay and I go like somewhere like Ghana, beautiful place, and I get COVID over there in Ghana, what are the rules and restrictions that would happen before I would have to come back over here?
But actually, nowadays there's no rules or restrictions. You don't have to tell anybody. Before, so up until January, I think it was 2021, you had to take a test to come back to the United States. You no longer have to take a test. So really, with COVID right now, we tell people when they get COVID, if you just have mild symptoms, a lot of people have allergies and it feels like a cold. We say isolate for 5 days. Once you no longer have a fever, just go about your business. If you feel like you need to wear a mask, if someone got sick while they were internationally and they need to come back home, well, our suggestion is to just always keep a mask on. But there actually are no rules or regulations.
Wow. And let me backtrack right quick. At what point, especially now, will a person need to see a medical physician if the COVID gets worse?
If the COVID gets worse, is where say if nausea, vomiting, and you can't keep anything in your stomach, and you're getting so dehydrated, if you can't breathe, and particularly if you can't breathe, because a lot of people, they've had COVID and they'll go home and they say, "Oh, I have COVID," and they'll sit there, but then they start to have, they can't breathe, they can't catch their breath, whether it's due to asthma or other things. They feel like it, so we want people to come to the hospital then, because one, we can give them treatments, we can that open up their lungs, we can put them on oxygen, um, and do things like that, because it's all about the oxygen level. You have low oxygen level, it affects your heart, but really starts to affect your brain.
Yeah, and I feel like I'm like one of those Google like doctors because like all my friends have been telling me I have a lot of friends in the medical field, and one thing they said about COVID: make sure you have one of these devices.
Yes, we call it a pulse
Pulse ox.
oximeter, where you put it on your finger and it tells it. It looks at your nail bed and it tells what your oxygenation level is. Basically, the oxygen circulating in your blood. Um, it depends on where you live and your altitude, believe it or not. So if you live at sea level, most people, we will like it 96 and above. Everybody don't have to be 100. So 96 and above is good. If you're living in the high altitudes, like high Denver at 7 or 8,000 feet above sea level, you may be 92%, and that's okay because the air is thinner there. But yeah, we normally check and want people 96 or above.
And I know for sure, like I said, because it goes to 100, y'all. You put it on your finger, and it reads your oxygen, like she said, it reads your oxygen level. Two things: I didn't know that if you put it on certain fingers, it reads differently on each finger. I didn't know that. I found out the hard way. It's this: I have a broken finger right here, and they couldn't read it. And I'm like, wow, it was like at 60. I'm like 60. I barely so it was like,
Your
whoa.
circulation is different in that finger because you broke it.
Yeah. And so, but a friend of mine told me, she's a nurse, and she said that if it's in the 80s, that's a sign that you need to go to the hospital.
It's not a good thing. We don't
Yeah.
like people in the 80s.
Yeah. And so, y'all, even though like you may get sick and stuff like that, that's I think an area of concern that people really should invest in the post ox machine just in case. Like, because me, like when I get allergies, I start to freak out a little bit because my nose is stopped up, and I don't know what's going on. And so,
Yeah. Everyone should have a blood pressure cuff, a thermometer, and a pulse oximetry. Those are, and you can get all those on Amazon,
or at Walmart,
Amazon, any drugstore, you can get it. Yeah.
fairly cheap too. So, speaking of having items with you, let's go back to you traveling and stuff like that. Within your book, and especially on your social media, you have a travel bag, which people probably don't ever think about. Give us some tips about the importance of having this traveling medical bag that everyone should have.
Well, once again, when I travel, I take a few extra things, but I tell people you should always have like a first aid kit. It doesn't matter what, just for band-aids, things like that. An ACE wrap, for particularly if you're an active person, you never know when you're gonna twist the ankle or bend your wrist wrong. You should always take your medications with you. I say at least 2 weeks supply, which we've learned when people get delayed. And of course, if you go internationally, they should be in the bottles with your name on it. Now, my travel box that I have has all of course, the wipes, the hand sanitizer, other little things like that. But then it has each. I sell it quarterly, so you can get it quarterly, and it just has different things like a luggage scale or a door alarm for safety for solo travelers, things like that.
Wow. And do you have any final message to those who are, I guess, one just addressing one final message for people that kind of really are concerned about COVID, and for them to actually not be as worried?
My final message for COVID is that it's manageable at this point. When it first attacked us in March 2020, we didn't know what the heck was going on. We didn't know about it. It's no longer a mystery virus. So it's manageable. Just be very cautious. If you get sick and you feel like you need to go to a doctor, go to a doctor to get that reassurance or to get that care. But it doesn't have to be a death sentence anymore.
Wow. Okay. There you have it. So my last question to you is So what's up next for Dr. Yvette McQueen? What do we have going on now when it comes to work related?
So when it comes to work related, I'm still traveling around the United States working as a physician, but I've also started my own travel groups. So, and particularly, most of them usually physicians, where I take them, and while we're on trips, I can give them different lectures according to their specialties. So I've started some. I'm doing 6 trips a year, and we're going to culturally immersion places like Ghana and Egypt and other wonders of the world, where we can relate it to our specialties.
I know you're just making me jealous along the way. Let me get my medical practice on so I can just go travel with y'all and be part of the group. But wow, Dr. Yvette McQueen, thank you so much for being on this journey with us and coming along the show and taking time out of your busy schedule to educate us and get us prepared and just overall just educating us on this virus. And I think you really have played a big part of this. And I just can't go on without thanking you and your colleagues and other medical people, because y'all really, you couldn't save everybody, but you saved a lot of people. So that does go a long way.
Thank you. I appreciate it, because usually with one patient, it's one at a time, but being able to tell the information here, I can touch many people all at once.
Yes, man. And like I said, even though she's already been to Africa, I'm going to Africa too, y'all. So if y'all listening over there in Kenya and Nigeria and Ghana, I'm coming. Just give me some time. But Dr. Yvette McQueen, once again, thank you so much for coming on Straight Up Show Podcast. Before you go, how can people reach you on social media and get the book and learn more from you?
Well, first of all, my website, I keep it very simple, is YvetteMcQueenMD.com. That's my website. Social media, Yvette McQueen MD. That's how you reach me. And the book, I say, is travel911book.com.
All right, there you have it. And if you're watching this show right now, we'll have it on the ticker below. And if you're listening, we'll have all her information in the show's description. Once again, Dr. McQueen, thank you so much for coming on the show. That's it for our show. Make sure you go to our website. To go to our website at straightupshowpodcast.com. That's straightupshowpodcast.com. And you can see our previous COVID Impact series episodes featuring Dr. Yvette McQueen, the travel doctor, and learn more about the vaccinations and what to do, and get more educated about traveling this summer and spring, because I didn't know about travel insurance. I'm pretty sure you didn't either, because it's just got me thinking hey, I might need some insurance if I go to travel abroad, because I didn't know they didn't take our insurance. I thought it worked everywhere. But go to our website, straightupshowpodcast.com, learn more, get educated, and be more culturally diverse when it comes to medical as well. If you want to support our podcast, go to patreon.com/straightupshowpodcast318. Patreon.com/straightupshowpodcast318. I had trouble getting that out, y'all. I know what's wrong with me. But until then, that's the end of our show. Until then, there's only one rule to our show, Dr. McQueen. You got to be
straight up.
All right. See y'all soon.